So you want to be a PT, huh? You want to know how it's like to be in this world as a physical therapist? Well, all right. I'll tell you how it is. What's going on, everyone? My name is Ben Choi from Go Physical Therapy. You want to be a physical therapist? That's okay. That's good. Physical therapy is a field in which encompasses you into this world of healthcare. You can utilize it in many various ways, and it's actually quite versatile compared to most other fields. In terms of physical therapy itself, we'll talk about a little bit of how physical therapy became a thing. What do you need in order to be a physical therapist? What other fields other than maybe in this office that I'm working in, that you can go into physical therapy, and what characteristics that are needed to be a physical therapist. So starting off with what PT is and how it became a thing, well, physical therapy is utilizing kinematics, body motion, being able to move around in time and space, kinesiology, in order to rehab a patient, rehab a client. So for example, if you do have shoulder pain, you go to a physical therapist. The physical therapist will try to determine what issues are causing the shoulder pain. If it's a musculoskeletal issue, something that relates to muscle or bone, they'll go ahead and try to rehab it in terms of exercises, manual therapy, some other modalities like ice, heat, or ultrasound in certain places, and they will go through a extensive course of treatment. It can last for up to a few days, up to a few weeks, or maybe up to a few months, and depending on what your shoulder condition is. And so, in terms of physical therapy itself, how it started is actually a certificate program back in the World War II, World War I era, where many soldiers came back from home and they needed some sort of way to get back into living normally. They maybe have blown out their legs, or maybe they're missing a limb, or maybe they just had severe damage throughout their whole body from the war. And so these nurses that were there, they took a certificate course in order to learn how to rehabilitate a patient from bed lying to being able to move around and get exercising. From there, the profession developed into a bachelor's degree, then it developed to a master's degree, and now as of recent, it has developed into a doctorate degree. And so in terms of education, it requires you to have 4 years of undergrad or some sort of undergrad certificate or degree. And that undergrad degree must include all the course load required for the particular physical therapy school. Once you apply to physical therapy school and you get accepted, it's another 3 years of education, and that's when you get your doctorate of physical therapy. Now, there are other places in which will allow you to get your physical therapy license or physical therapy degree in 6 years, in which they'll combine 3 plus 3 of some sort, where they'll have 3 years of quote-unquote undergrad, and then 3 years of physical therapy school. With physical therapy school, you'll have a majority of your time being in class and learning the physical therapy profession, whether that's learning through hospital settings or learning through manual therapy and outpatient settings, and you will be sent to different locations to work. There will be one dedicated year, at least for me, from the University of Connecticut, in which you will be doing clinicals. And so clinicals meaning you'll be going to a site for a few weeks and learning their system of operations, learning how to take care of their own specific patients, and essentially being a physical therapist under them. You'll be a student physical therapist during that time. Once you finish your clinicals, that's typically when you will graduate. And when you graduate, you have to take what's called the national exam. The national exam for physical therapists is an extensive exam, and you have to pass that in order to get your license. At least in the state of Connecticut, you are required to take this exam. It's just one exam. For me, it took about 5 hours, and it's 250 questions. Physical therapists can exist in many different ways in different areas of healthcare. Right now, in this setting, this is GOAT Physical Therapy. We are a cash-based clinic in Gales Ferry, Connecticut. We are considered outpatient-based clinics, but we are cash-based, so we're not utilizing insurance that much. People will typically pay out of pocket to come here or utilize their out-of-network benefits from their insurance in order to come here. Otherwise, you'll see traditional outpatient clinics that do take insurance, which usually take whatever insurance you have, and you'll be given a number amount of visits or whatever visits that are given from the insurance. There's also physical therapists that you'll see in a acute care setting. For example, if you are suddenly in a car accident and you need to go back home somehow, but you need to have some sort of ability to prove you to be able to go back home by moving around and be able to go to the bathroom or go ahead and walk around the hospital building. A physical therapist is there for you to determine that. There's also other settings too, like skilled nursing facilities and intensive rehab units, and possibly in home care, where physical therapists will help you get back to where you were or try to get back to your baseline based on what you had before. So all that being said, in terms of the education and where physical therapists can exist in the healthcare system, can you become a physical therapist? Maybe, yes. But physical therapist is more than just working as a healthcare worker where you have to learn how the anatomy works in your body, learn certain conditions and diseases. You have to be more than just being book smart. You also have to be a very compassionate person who is able to understand and listen to the patient that is in front of you, and to be able to almost be a therapist in itself where you're listening to the patient, trying to understand where they're coming from, try to be empathetic or sympathetic with them, try to make them feel good and understand their emotions throughout the whole time. Give them confidence into being able to be more better or being able to move better or being able to get around the building better or get around the community better, and ultimately help them improve their lives, help them improve what we call the quality of life. And that's actually the more important piece than the education side of things. For me, I recently graduated from UConn in 2023, and yes, I'm very much a rookie in this game, and I don't really know much, but most of my patient interactions are very good, and they trust me. Why? It's not because I have 25 years experience and I am the leading research in physical therapy. It's because I'm able to talk to my patients really well and develop a really good relationship with them, and they understand that I have their back. And so if you're able to establish these kind of characteristics and personalities as a physical therapist or as a human being, you are going to be a good physical therapist. With all this information said, if you have any more questions or comments or concerns about the physical therapy field or what I can answer, go ahead and leave them down in the comment section below. I'll be happy to answer them. Otherwise, like, subscribe, and share our video because there's going to be more videos coming soon on the channel. Peace.